Hello, everybody. Welcome to Evidence-Based Practice. My name is Mary Kavishi. So, my conception of evidence-based practice is after the lecture and the reading, evidence-based practice combines clinical expertise, external evidence, and patient choice to make appropriate clinical decisions. Evidence-based practice plays a key role in shared decision-making, which can improve outcome and patient satisfaction. Because when you have the evidence to show what works and what has worked in the past, it is easier to come up with a better treatment plan that will be beneficial to the patient, and the patient is most likely going to adhere or follow through with the treatment or the guidance provided. Evidence base is constantly updated due to new studies and outcomes as we see things keep changing. So, conception before reading, even though I have learned this from school before, this is exactly how I looked every time I hear somebody talk about evidence-based practice, because I just felt like, okay, that means going to find all of these literatures and I don't know where to find them. I gotta look for the papers and I don't have access to the university database anymore to look up things. It is just quicker and efficient to just ask a colleague, especially somebody who's been working for some time. So, they know what they're doing. They can give me a good information. And then there's the time constraints. It will require me making extra time to do this, which I don't have. So my definition of evidence-based practice now, after the lecture and the reading, is I'm viewing it now as a comprehensive approach that helps provide quality care using well-designed research, clinical expertise, and it'll incorporate patient-centered. It is also efficient assessment, treatment intervention that have been proven to be successful using the literature again, the expert knowledge, and client or patient positive outcome. Misinformation about evidence-based practice. So it sounds like it is complex, it is time consuming, and it is outdated. There's no access to materials. We already learn a lot more what we need to know from school. It is quicker to rely on what we know or ask colleagues. These are all misconception that makes it harder to follow through and to advance, especially in therapy when it comes to evidence-based practice. What can be done? More education is definitely needed because I have learned quite a bit on that I don't need to spend hours researching the information, researching the literature to find the evidence. Also, just finding what are we missing and presenting evidence, highlighting solutions and possible outcomes. On the job training, including mentorship and also advocating for more evidence-based practice with your leadership or with your management where you work, highlighting the importance of it. I'll go back to finding what's missing. Like, okay, we don't have access to journals and articles, then maybe requesting to see if we can get funding to get articles, but also there's a lot of free materials that are available. And that is it. And there is my evidence from our readings.